And this is Dr. J with
Hey
Texas
guys.
Functional Health Centers. Today we're going to talk about subluxations and chiropractic. So
Yeah.
I think most people think you only come to a chiropractor when you're in pain. I mean, the truth, the adjustments do help with the pain, but they're really going to help a lot of people with keeping you moving, keeping you functioning,
Yeah.
and really able to live the 100% of your life, right? So every bit of our life. And so we're going to talk about those things today. We're going to jump into more of what the subluxation is, what it does to us, different reasons that we would have an adjustment, different reasons we would need an adjustment, and situations that we would need an adjustment, not just when we're in pain, but other parts of our life.
Yeah.
Okay. So we'll jump into the subluxation. So a subluxation is a term that chiropractors like to use for a biomechanical lesion. Other providers, so like osteopaths, are going to call it a somatic dysfunction. Joint dysfunctions, restricted mobility, functional joint blockages. There's a lot of different names for the same thing. A good umbrella term for this is going to be a biomechanical lesion.
Things not in the right place.
Right? Things not doing what they're supposed to do. Right? So it's not just the joint itself, but it's all the associated tissues. So we're going to think the muscles, the ligaments, the connective tissues, the nervous system, the blood vessels. So everything that's associated with what makes up a joint. And they're quite complicated, not just two bones together, right? So let's talk about some of the things that happen when we have a biomechanical lesion. So a joint that's not moving the way that it's supposed to. This can come from something as simple as a slip and fall, car accidents, sports injuries, repetitive motion injuries. So I'm doing the same thing over and over. Something as simple as a bad posture. So I always like sitting with my legs crossed and leaning to the right hand side.
Oh, I love that one.
Right. So there's a lot of reasons
girls
that we can
do that all the time. They want to sit on their foot. And I'm like, please do not do that.
Right. Or guys that always have the 4-inch wallet always on the right hand side.
No. It's never good.
Definitely going to get us.
Right.
Excuse me.
It's kind of like if you just wore a heel lift in one side. Right. You'd end up being all tilted over. Right? It's like that. Don't do it.
So definitely, that's going to be a part of the discussion of what the detriments are of the biomechanical lesion or the subluxation.
Yeah.
Probably one of the main things is going to be the pain and discomfort. So that's the main category that we'll talk about first of all. So generally, when a bone or a joint's not moving the way that it's supposed to, we're going to get some kind of discomfort. It doesn't necessarily have to be an immediate, sharp pain or anything like that. It could be a dull ache. It could be a soreness, a tightness.
But do you have to have pain?
By no means. Right? So pain is usually the last thing to show up and one of the first things to go away. So it's a really bad... I like to say it's a really bad arbiter of what's going on the inside. A really bad indicator for the condition that we are in overall.
Yeah. We always like to relate it to a cavity, right? By the time you feel the pain, it's a little too late, right? It's already been forming.
Already there.
Yeah, it's already been forming. It's already taken root. It's already there.
Right. So pain, referred pain. So when a joint's not working correctly, we can get referral of pain somewhere else. So,
and that one's always interesting. Hence the reason we don't chase symptoms, by the way. Whenever somebody's like, oh, I'm hurting right here. Okay. Well, I need to figure out just a little bit more because it may not be right there. That may not be the actual issue.
Because the wrist bone's connected to the elbow bone, which is connected to the shoulder bone. So we usually get problems with everything. And by the time you have a discomfort or pain, usually we're going to have that functional deficit that's affected surrounding tissues and joints. And so usually we'll see some referred pain. Some things will be hyper-excitable, so that means they'll be very sensitive to input. So we use this particular joint as if I'm not using it, it's fine. But every time I use it, I go for a run or something like that, and my knee hurts. So that's definitely an indication of something that's not working correctly, but one of the pain generators that would come from that biomechanical lesion. And some of the anecdotal things that we'll think of is that it affects the nervous system. So it affects the way that our body communicates to our parts and pieces and the way that those parts and pieces communicate to our brain. So anytime that we have a disconnect between those two, all of a sudden we have some level of dysfunction that we'll see. Really interesting anecdotal things is that it affects organ systems even. So every cell in our body is communicated to by a nerve. Every one of those nerves goes through our spine. So if we have some problem with any of those joints, the communication of those joints, it's going to affect the nervous system. In turn, if we affect the nervous system, it affects the blood flow, which is another interesting thing because our nervous system does have some effect in the blood flow to those parts and pieces.
Oh yeah, for sure.
And
that's such a hard concept to really to really wrap your head around, I feel like, for
Right.
most people.
Yeah.
Like it just is. Like we can, if we can get to that point where like we understand that a muscle is controlled by a nerve, which we kind of can, because we get to actually feel that.
Yeah.
Right?
Very
If they're
perceptible.
right, we can feel it, we can see it. Like it's tactile. Like if this nerve isn't working, this arm no worky.
Right.
But it's so different whenever we're talking about organs.
Yeah.
Because like that's inside of us. We don't really get the same connection.
Right. And like, I guess a weird thing that we see in practice. It's not something that I would go out and seek for a particular patient, but a lot of times people that have acid reflux, so chronic acid reflux, once we get their upper back moving and we reduce the number of those biomechanical lesions up there, a lot of them don't have as much symptoms. So they have a lot less of that acid reflux. We don't know the mechanism exactly behind it. There's not enough research to tell us that those things, how they work, how it affects it. So it's not something that I'm going to just go out and tell you I can fix it.
Right.
I have no clue.
Right.
Just something that happens sometimes. So that's just one of the anecdotal things that we think of, that the subluxation can affect organ systems, not just the joints.
And the same thing you were saying on like blood pressure as well.
Yeah.
Like sometimes we'll see a drop in somebody who has high blood pressure. Now, like, is that guaranteed? Is that like something that is always going to happen? No, but
we don't
very
know,
often.
We don't know if it's the effect of the reducing the pressure on the nerves, so the communication of the heart's better. We don't know if it's the reduction in the inflammation as the whole of the system, just because you have less inflammation or less pain, that may be what's reducing the blood pressure. So we don't know the mechanisms behind it. So it's just something that happens sometimes.
Right.
Right. Muscles are definitely affected by biomechanical lesions. The way that our body talks to our muscles is very, it's like very finite, and it has a lot of detail behind it. So in order for me to move my fingers and do things with my hands, there's a tremendous amount of information that's going to my hand, from my hand, back to my hand, to make sure that we're doing what we're doing. So there's a lot of nervous system interaction that happens within the muscles, within the joints, within the connectivity. So you can imagine if one of those things is just a little bit off. So I'm not saying 100%, but 10%. It's going to affect the way that our body recruits and uses the muscles. So we'll see different tonicities. So too much tone, too little tone. It's definitely going to get a lot of things like that. And spasticity is one of the things that we'll see over time. So if we have a joint that is not working very well over a long period of time, we're going to get a lot of spasms in muscles. We're going to get recruitment of muscles doing different jobs than they're designed to. If you prolong the abnormal use of a muscle, it's going to develop what's called a trigger point. So we get little spots within that muscle that actually die off because they have so much scar tissue in them. They don't have enough blood flow. They cause all kinds of referred pains, discomforts. It's going to be those knots that you feel in your traps.
Oh, always fun.
They're just always tender. You pretty cut and clear. We know that if it doesn't talk to the muscle or it doesn't talk to the joint, the muscle's not going to work the way it's supposed to. So it's pretty easy, to get that one going.
And that relates back to posture too.
Yeah, for sure. And so the effects of the function of the system being affected by those subluxations. One of the other things that we're going to talk about is the vascular changes. So when the nervous system's not working correctly, when the muscles are really tight and in spasm a lot, we're developing more and more inflammation. We're going to have less blood flow through the system. So it's due to more of that inflammation process, but it's going to reduce the blood flow. That's going to leave more of the toxins in the muscles longer. So we're going to have more of the lactic acid buildup. So we're not going to have a lot more of the clearing. So that particular muscle is going to be sore a lot more, a lot easier. It's not going to recover as quickly. So we don't have as much of the nutrients coming in and out of it. So it's going to have less function, more propensity to damage as well. So that's an
which, like, you wouldn't really think about that, right? Like, that wouldn't be the first line that you jump to.
We start getting connective tissue disorders. So if I have a chronic stress or pressure on a ligament or something like that, it's definitely going to cause scar tissue to build up in that. It's going to cause inflammation. Chronic inflammation of anything is going to cause more fibrosis or breakdown of those parts. Long term, we would call that osteoarthritis. So the subluxations or the biomechanical lesions lead to that breakdown of the connective tissues, and that's where we start to see more and more of those problems. We get lots of
Good.
compensatory deficits, right?
So like that's how we end up with this
right,
degeneration, right? Like that's how we end up
no
here.
space between the bones, all kinds of bone spurs, all of it starts getting really gnarly and rusty looking.
Right. So if we don't have blood flow, if we don't have motion, if our nerve system is messed up, like this is inevitably what happens. And this is what happens whenever you go into the office, whether it is a chiropractic office or neurology or anything else, really. And they're like, oh, you have degeneration. Like that is how that happened.
Wow. So our purpose is to exist before the degeneration. So by the time you have some severe degeneration, usually you're going to end up in the orthopedics office. No matter what I do, whatever anybody else does, no matter how much you work out, by the time it goes too far, it's really too late.
Right.
Right. So our job is to catch it before that and be able to take care of it. So the other indicator, so any discomfort or pain is going to tell us that something's not working right.
It's the alarm. I always like to call it the alarm. It's like,
canary
hey,
in the coal mine.
Right, it's trying to tell you something. Your body is always whispering, are you listening?
Right. She was talking about the function. So if I have a subluxation or a biomechanical lesion of my knee, it's going to affect the way that I walk.
Mm-hmm.
It's going to affect the way that I use the muscles in my pelvis, my lower back, my upper back, my neck. Over time, we're going to see all kinds of crazy compensatory changes. We call it the domino effect. So once one thing goes bad, it's going to start to affect the next thing in the line, the next thing in the line. You'll see people walking around, instead of being nice and straight up and down, they'll be twisted like this. Usually they're going to have either a disc herniation or lesion. They're going to have one of the joints that's really not working very well on one side of their spine, or they're going to have a hip or a knee that's not working correctly. And so we get all kinds of altered biomechanical functions or function out of our body just having one subluxation. And then it builds up over time. It causes more subluxations in other parts and pieces. And so we get more and more and more of this buildup, and everything just starts falling apart. That just in turn is going to increase more stress on the system. Systemic inflammation is going to get worse. Your function is going to slowly degrade. And by slowly, we mean super slow, right? So I have a subluxation in my knee. 10 years down the road, I may see the compensation showing up in my lower back. It's not instant, but it builds up over time, and it's almost imperceptible. It's
like a tree growing. Like, think of it like that. You know, like if you go out and you look at the tree, right? You're all like, I don't know, maybe is that like a branch? I'm not sure. Anyways, and then you keep going out there, and it's so slow that you don't really see it until one day. What happens is you walk out in your backyard and you see that. I say this because this happened to me the other day. Okay, you walk out in your backyard and you see the tree, and you're all like, how did it get so big? And that is how it got so big. It was just slowly growing a little bit at a time.
We hear that from patients all the time about range of motion and different changes. So most of them will say, I never noticed I couldn't turn my head to the left until all of a sudden I couldn't look backwards while I was trying to drive down the back my car out of the driveway.
Right.
And then you kind of go, how'd that happen? And they had lost 60 to 70% of their range of motion in their neck. Didn't even know it.
Right. Because just because it happens, and then you're all like, that's fine. Right. Oh, maybe it's just today. Oh, maybe I just feel that way right now. Oh, that's fine. And you start,
just live with it, right?
Right.
It doesn't hurt.
Until like all of a sudden you're turning like this.
Yeah. It's because you didn't have any pain, right?
Right.
Yeah. So if it's not in any pain, we don't have to do anything about it.
We don't have problems.
No. Okay. So that's what we're here for. That's what we're talking about. So adjustments are not for just when we're in pain. So all those are all the bad things that could happen with the subluxations and the reasons that we should probably get adjusted outside of a pain thing. Everybody's going to get subluxations to some degree or biomechanical lesions. It's just a day-to-day life. You're not living in a bubble. So there's lots of things that are going to happen, and we're going to build up some of these biomechanical lesions, albeit very small in most cases. Very little of the effect until years and years and years down the road.
Saying that you're never going to have a subluxation is like saying you're never going to get a scrape. You know what I mean? Like, what are the probabilities of that? It's very, very slim, right? Just living life, growing, getting older, having children, jumping out of airplanes if that's your thing, whatever. Like, just living life, you're gonna get them. Like, it's just the way it is.
And maintaining our function is another thing. So just
Mhm.
because I eat a healthy meal once
Oh,
doesn't mean that
yeah.
I'm going to keep being healthy.
Right.
Just because I had that one salad doesn't mean I'm going to keep my weight
Right.
off.
Just
So
because I cut my lawn one time does not mean
it's
that
done.
that I never have to do lawn
Right.
work again.
So our bodies are always growing. They're always adapting. They're always
Yeah.
replacing tissues. And so everything's always changing.
Oh,
Everything
for
within our
sure.
body is always
Yeah,
changing.
yeah,
There's
yeah.
no way that it's not going to change.
Yeah, everything in your body gets replaced. Every single thing.
Right.
And let's say that you've lost weight and gained weight a bunch of times. Let's say that you sprained your ankle and then your knee, and right, and then you were going on this bicycle adventure or training for a
Triathlon.
triathlon. Yeah, that's it. We have some friends who train for triathlons.
Ironman.
Yeah. And so whenever you're doing that, like, you have to keep up with it as well. You have to maintain it in order to carry on through life the way that you want to.
Yeah. And so that's just one side of it,
Mhm.
right? We're just thinking about, the detriments, the biomechanical lesions, the things that could go wrong if you don't get it taken care of.
Yeah.
Ooh, there's lots of benefits of chiropractic adjustments for happy, healthy people.
Yeah.
It increases nervous system function. So
Mhm.
a lot of the systems tell us that the way that our body communicates to our parts and pieces, it lowers the load on our brain. So we
Mhm.
have more function of our brain.
Yeah.
More clarity, less inflammation systemically in the body. So just the low level inflammation that we always
Right,
have.
because you have like these little fire alarms in your body all the time.
Yep.
And so if you can reduce those fire alarms within your body, then naturally, like, your head clears up.
And so you'll hear chiropractors all the time talk about an interference-free life.
Oh,
That's
yeah.
definitely a thought that we have. So
Mhm.
we're really just looking for optimal performance. So, like the superhumans and everything else, you take some B vitamins, methylated B vitamins, it's going to take care of that particular metabolic system. We're just thinking about the other side of it. So not just what happens in the chemical reactions in your body, but what happens mechanically with your body. This is just the happier and healthier your parts and pieces are as a whole, the better you're going to live, the longer you're going to live with more function and more health.
Yeah.
So that's really the call to action that we have here, is that it's not just for when you're in pain.
Yeah.
And maintenance adjustments, just getting adjusted once in a while. Like every other month, once a month, that kind of thing. So just like getting your teeth cleaned, same thing. We're just preventing any of this stuff from taking a foothold and changing the way that your body works.
Right.
So even our normal patients, once we get them into some normal function, things are starting to work the way they're supposed to. Most soft tissue healing from that initial damage is going to take 12 to 18 months to reset back to that normal function.
Right.
Think the disc, for instance, it takes your body 18 months to replace the cells that make up your disc. So if you change the function of one disc, it's going to take 18 months for that thing to change its size, shape, and function in reaction to it.
Right.
So just because I adjusted you for a couple months and got everything moving and made it happy and healthy, and you have 99% of your function, it's still not moving right. And so we still got to do a little bit to keep it moving. So as it changes, we keep that range of motion going. Right?
Yeah.
Don't have any pain at all. I get adjusted once in a while. So I usually don't have much discomfort or pain. I still get adjusted a couple times a year, no matter what.
For sure.
And it's just to make sure that nothing happens to me.
Yeah.
I mean, I'm crazy. I'm playing golf all the time, jumping off of boats and doing crazy stuff. So I need to make sure that I take care of any of the possibilities of those lesions that I would have created.
Right. And so usually what people say is, it's like, oh yeah, like once I get adjusted, like it always seems like I always have to get adjusted, kind of thing. And the truth is, like, you don't have to.
No.
Right. So like, you don't have to. You don't have to brush your teeth every day. You don't have to take a shower every day. Maybe take a shower. Maybe you're like, oh, I took a shower last week, I'm good to go.
I'll be all right.
Yeah, I'll be all right. So it really just kind of comes down to, like, what do you value?
Yeah.
Right. Like if you value living optimally and like living into like your older ages with function, like if that's something that you care about, then yeah, I would say that getting adjusted kind of plays a piece in that, just like eating healthy, just like going for your dental appointments, just like working out and being active and being around people that you love and social interaction. all of those things keep you functional, keep you healthy, keep you happy.
Just a small piece of the puzzle.
Yeah.
And if you don't work, if you don't function, it's really hard to do a lot of things in life.
Yeah.
You know, by the
Oh
time
my goodness.
by
I
the
think
time my
we've
knee
just
stops
heard
working,
so many stories that we're like, oh man.
right? And that's unfortunately that's the reason that most people show up here. Is that
Yeah.
some portion of their life, a door has shut.
Yeah.
And they
Yeah,
miss
yeah,
that.
yeah,
They
yeah,
miss
yeah.
going through that door. I can't go on the Sunday morning jogs with all my buddies in the jogging club anymore.
Right.
I can't play pickleball with my husband on the weekends. Like lots of those kinds of things.
I
It's
had to turn
finally-
down the cruise ship.
Yeah, because I just knew I couldn't get off the cruise ship,
Yeah,
or
yeah,
I was taking my kids to Disneyland and I had to be in the little hover scooter the whole time,
Yeah.
so it just
Yeah,
slowed
that one's
everybody
rough.
down.
Yeah.
So you know, unfortunately, that's what we hear all the time.
Right, yeah.
There's a reason that we always talk about maybe we should do something preventative.
Yeah, maybe.
You know, we should get this taken care of. But it's
Yeah.
a lot more effective and efficient too. So
Oh man, yeah.
we don't have to do through
so-
any kind of crazy
so
amount of
much quicker,
adjustments to get it back.
easier, better, simpler. Yes, for
Yeah.
sure.
So adjustments aren't just for when you hurt.
Yeah.
Right? You could always come into our office and experience the process. We can talk to you about subluxations. We can see if you have any subluxations.
Mhm.
We always have a nice little special going on. So the new patient special this month is $99.
Yeah.
If you want to get in on that, it's on our website, texasfhc.com. You can get through on our Facebook or Instagram. We can get you through on that one anytime and get you checked out if they're interested in getting that looked at.
Yeah.
If you guys have any interest in any topics for videos, I'd love to see that in the comments.
Yeah.
Put it on our Facebook or Instagram. You can put it here. I'd love to be able to talk about things that interest you guys.
Okay.
Right?
Instead of just whatever we come up
Right,
with.
whatever I'm coming up with. And we'll see you guys next time. Maybe we'll see you in the office for an adjustment.
Yeah.
Have a good one.
Bye.